Morning, everyone. My name is Ben Ishima, and today I'll be presenting my case study on delayed medical diagnostics in Rwanda. Specifically, I'm going to focus on the impact of delayed or late diagnosis, which is the main factor contributing to the preventable death and poor health outcomes in our country. Healthcare is not only about treating diseases, but it is about identifying diseases early enough for treatment to make a difference. Across Rwanda, many parts of Africa as well, thousands of people seek medical attention every day. Unfortunately, many receive their diagnosis too late when diseases have already progressed and escalated to advanced stages. This challenge affects patients' survival, increases healthcare costs, and places enormous pressure on the healthcare system. Today, I will explain to you why delayed diagnostics in Rwanda, as well as Africa, might be a main uh, and most significant challenge to healthcare, and how it relates to the grand challenges and opportunities framework, and what factors contributes to it. We're also going to look and explore more into the innovative solutions that can help to improve the healthcare outcomes, specifically on this point of diagnostics, medical diagnostics. Delayed medical diagnostic or medical diagnosis refers to the time between the onset of symptoms and the accurate identification of a disease. While some delays may be unavoidable, many occur because healthcare systems lack sufficient diagnostic resources, trained personnel, or efficient referral mechanisms. In Rwanda, although remarkable progress has been made in expanding healthcare access, patients in rural communities often travel long distances to access specialized diagnostic services like cancer diagnosis. Health centers may not have advanced imaging technologies, specialized laboratories, or sufficient medical specialists to help patients in the local areas, specifically in rural areas. As a result to this, diseases such as cancer, cardiovascular diseases, diabetes, tuberculosis, and kidney disease are frequently diagnosed at later stages. By the time treatment begins, the disease may have become more difficult and expensive to manage, reducing the patient's chances of recovery. So this demonstrates that improving diagnosis is just as important as improving treatment. This issue of delayed diagnosis connects to several grand challenges and opportunities. The first is health and well being because early diagnosis directly improves and impacts patient survival and quality of life. But also, second is technology and artificial intelligence. Recent advances in AI can assist people who plays a very big role in clinical medicine by analyzing medical images, identifying disease patterns, and supporting faster clinical decision making. These technologies have the potential to increase diagnostic accuracy while reducing waiting times. The third is innovation and entrepreneurship. Innovative healthcare solutions can complement existing health systems and making diagnostics more accessible, affordable, and efficient. Finally, this challenge also relates to the leadership and governance, since governments play a critical role in investing in healthcare infrastructure, developing health policies, and ensuring equitable access to quality diagnostic services for all citizens. Together, these grand challenges show that delayed diagnostic is not simply a medical issue, but it's a multidisciplinary development challenge. We tried to analyze the problem using the DCASP framework, and we came to understand that, first of all, this challenge of delayed diagnosis of diseases leads to avoidable illness, higher healthcare costs, and preventable death. So, the several factors contributing to this solution includes like limited diagnostic equipment, particularly outside major cities. The second factor, there is healthcare professionals with specialized diagnostic expertise remain limited to compared to the growing healthcare demand in the country. Third, patients often experience long referral processes before reaching facilities capable of providing advanced diagnostic services. Fourth, awareness of early disease symptoms is sometimes limited, causing individuals to seek treatment only after conditions have continuously or significantly worsened by the diseases. So all these affected stakeholders include leads to the effect on several different stakeholders, but among those stakeholders, there are patients, families, healthcare workers, hospitals, the Ministry of Health, insurance providers, society, and the society as whole, because delayed diagnosis reduces productivity and increases healthcare expenditures. This illustrates that delayed diagnostics is a systems challenge requiring collaboration across multiple sectors in the country. Uh, there are several different possible solution that comes after addressing this issue of delayed diagnostics. But addressing this issue requires both healthcare system improvements and the technological innovation. The first solution is expanding the diagnostic services beyond referral hospitals by strengthening district hospitals and local health centers in rural areas. Second, we need to continuously invest in laboratory facilities, medical imaging technologies, and diagnostic equipment are essential and very reliable in our country. Third, Rwanda can accelerate the adoption of artificial intelligence to assist healthcare professionals in identifying diseases earlier and improving clinical decision making. Fourth, community based screening programs can help detect diseases before symptoms become severe, as well as help as well to advise what to do in case medication is not provided immediately. Digital health platforms can also improve communication between healthcare providers, making referrals faster and reducing unnecessary delays. One example of this type of innovation is the work being explored through the Boho Biomedicals, which seeks to leverage artificial intelligence and machine learning to support earlier disease detection and improve access to diagnostic services. Rather than replacing healthcare professionals, such as technologies are required and designed to support people working in this medical sector by providing timely insights that can help to to earlier intervene and better help patients for better health care outcomes. So innovations like this demonstrates how entrepreneurship can complement national healthcare systems in solving complex public health challenges. So in all, when you look into what's going to happen in the future, first of all, we need to take action. Without taking action, we're going to continuously see increasing burden of the non-communicable diseases, higher mortality rate from preventable diseases, and raising healthcare. As well as if we do act on this problem, earlier disease detection, improved survival rates, and lower treatment costs are going to be the benefits and the outcomes resulting from this problem. This matters at all because timely diagnosis is the foundation of effective healthcare. Strengthening diagnostic systems through policy, technology, workforce development, and innovation can significantly reduce preventable death while improving equity and quality of health across Rwanda. Thank you very much for watching.